As Nigeria continues with the struggle on how to eliminate malaria, there is need for citizens to fully embrace the various interventions provided by the Ministry of Health and Development partners. Consistent use of insecticide-treated mosquito nets, especially by children and pregnant women, remains significant in reducing the malaria burden across communities. Medical experts and health professionals always advocate proper hygiene, avoidance of stagnant water, and evacuation of drainage systems and refuse dumps. What efforts are Nigerian communities putting in place to end malaria burden? This and more will form part of our conversation on Nigeria Today. Thanks for joining us. I'm Eucharia Clinton. Now with me in the studio for the conversation is Chuks Alu. He's the Monitoring and Evaluation Officer, FCT Malaria Elimination Program. It's good to have you on Nigeria Today.
Thank you very much. Thanks for having me, and good evening, listeners.
And joining us via Zoom is Professor Olugbenga Mokolu. He's a strategic advisor to Minister of Health on malaria elimination in Nigeria. He's also the co-chair, Rollback Malaria Case Management Working Group. It's good to have you on Nigeria Today, sir.
Thank you very much, Eucharia, and good evening, viewers.
Prof, I would love to, to start with you. Talk to us about malaria. It's been a kind of, will I say, a thorn in the flesh, for a very long time. Now, talk to us. What is the state of, malaria in Nigeria?
All right. Well, malaria is an age-long disease, and it has really been a thorn in the flesh, as you use that phrase, and troubling mankind. But over the years, there has been different efforts to control the disease, eliminate, and at some point, efforts towards global eradication. Progress has been made, but in Nigeria currently, we have about 66 to 68 million cases that still occur annually. With figures are known that Nigeria contributes 27% of global malaria burden and about 31% of global malaria deaths. That said, we had improved over the years, declining from what used to be the prevalence in Nigeria of about 42% in 2010 to there around 21%, 22% in 2021, and current estimates indicate that we're still on a further downward trend. Also, in our respective states, the state of the burden is very different from one place to the other. And if you follow the news recently, the Ministry of Health was in Lagos together with the development partners, declaring Lagos as a place where malaria has so reduced that it is now being classified as an elimination zone. Not that it's fully eliminated, but that is evidence of some of the progress that has been made. So the variability in the states now is such that we had to target specific interventions to different states. So currently, malaria, I've told you the burden, about 68 million cases do occur annually, and about 198,000 deaths do occur. It's still the leading major public health problem in the country. But the context of that is that we've made a lot of progress, and there are also new initiatives that are being put in place to accelerate that progress.
Thank you very much, Prof, for that opening remark. Now, Chuks, you had, of course, what Prof said that there concerning malaria as regards the entire Nigeria. Now, talk to us about the FCT. You are the Monitoring and Evaluation Officer here in FCT. So what is the case like?
Yeah, FCT contributes about 18.8% of the Nigerian burden. That's about 19% approximately. And only about 31% of children have access to insecticide-treated net, and 42% of these people use or have a sleep inside the long-lasting insecticide-treated net. So it means that malaria still remains a very big public health issue. Yeah.
Okay, now, Prof, today it's World Malaria Day, and of course they are talking about the theme for this year's event is reinvest, reimagine, and reignite. And the slogan says accelerating the fight against malaria for a more equitable world. How does this resonate with Nigeria as a country?
Right. So that is a component of that theme that is being left out. The first phrase is really that malaria ends with us. Okay. And you could see that emphasis on ending with us, demonstrating the collective when it comes to the fight against malaria. Everybody is important. Everybody is a stakeholder. And we want every household to be the unit of elimination of malaria. And so to that extent, we have a resonating message this year that is consistent with the direction of efforts to accelerate malaria reduction. Now, the reinvest, reimagine, and reignite is dealing with these three components where we have to look at our investment, resource mobilization, making sure that we're not weary, looking for new funding, and thinking creatively around the funding, because malaria is not a condition that is static. So you will not say that you have made progress to this point. At any point you stop investing, you're likely to lose your previous investment. So there has to be an encouragement and a message to reinvest, okay? And in that regard, the country is making effort. The president had set up the National Malaria Council under the chairmanship of the Alhaji Dangote as another mechanism of raising funds. Through the Honorable Minister's Office, we have had the establishment of the PVAC, Presidential Initiative on Unlocking Value Chain, to ensure that we have local production of anti-malaria commodities. There is stronger emphasis on public-private partnership and general ways of exploring to get more funding. So that's reinvestment. Reimagine is for us to think critically about what we have done over time. They say it's only a fool who does the same thing over and over and expects a different result. So we've made progress. Some things have worked. Some things have not given us quite the results that we wanted. So we need to be more creative. We need to look at new opportunities. You see that recently Nigeria introduced the malaria vaccine. There are other interventions that we had not been using on a large scale, but which we are trying to bring in order to benefit from their complementary role. Things like indoor residual spraying, larval source management, as well as things like community engagement, citizen engagement. All these are areas for us to reimagine how we are deploying our anti-malaria commodities for effectiveness. Then to reignite is just to make sure that we keep the energy going, we keep the momentum, we sustain the effort, and we get everybody mobilized into the efforts that we're making. So if you think of where Nigeria is, this is really the time where we need this type of thing to ensure that we continue to press on previous gains, that we may then go to our last mile objective of eliminating malaria in Nigeria altogether.
Okay. Now, back to you, Chuks. You know, from what Prof had given, or the figure he gave us, we've had 27% of all cases, you know, talking about global figure now, the 31% of deaths globally. And we keep seeing these figures increase in terms of numbers, talking about the deaths, over 190,000 deaths, you know, approximately. Now, this brings us to the next question. Are Nigerians adequately informed about preventive measures to, you know, stop malaria?
Well, in FCT, we know that a lot of persons still lack knowledge in terms of the preventive measures when it comes to malaria. And why am I saying this? Because this year, World Malaria Day, was commemorated in Asokoro District Hospital under the leadership of Dr. Adedolakbo Fashawe. That's the Mandate Secretary, Health Services and Environment Secretariat. And we saw a role play where community people displayed a cultural display where they felt that malaria is something that is being brought to them by enemies rather than a bite from the female Anopheles mosquito. And so it means that we still need to take the awareness into the communities, because a lot of them up till now, some of them think that malaria comes as a result of maybe when you walk under the sun in farm, and so you can come down with malaria. And so these are some of the measures we need to correct, and then build them adequately on knowledge.
And some even think that if you eat a lot of groundnut oil or palm oil, you come down with malaria.
Yes.
I've heard people say that.
Yes, a lot of them think that when you take palm oil or groundnut oil or stay under the sun, that you're likely to come down with malaria.
So
However,
talk to us now, because a lot of persons are listening now, to talk to us about what actually makes one, you know, let's say, contact malaria. And is it transferable to the other person? You know, is it contagious?
yes, malaria comes as a result of bite from the female Anopheles mosquito that is having bitten somebody who is already infested. It transmits it from that person to another person. So what am I saying here? That if you don't have the Plasmodium parasite in your bloodstream, the mosquito is just going to have a blood meal. However, it transmits it from an infected person to another person in the course of feeding from the person's blood. So part of it drops from the saliva and gets into the bloodstream, and then finds its way into the liver, and then from there it gets back to the bloodstream and multiplies, and then based on the person's immunity, the immunity determines how fast that person can come down with malaria. So that sometimes people carry the Plasmodium parasite in their system, and then they will just be managing until they come down with malaria.
Thank you very much, Chuks. We are going to take a short break now. The conversation will continue after the break. Don't go away.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow, under digital economy, for banks not to be dispensing domestic currency in that economy.
What will make this one different?
We want to know what they do as occupation. All of these are attributes that are questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today. welcome back. In case you're just joining us, this is Nigeria Today. We're looking at the role of Nigerians in ending malaria. And of course, I have via Zoom a professor, and also here in the studio we have a monitoring and evaluation officer of the FCT. Now, Prof, of course, Chuks has said some things there about malaria, educating a little bit about malaria, but then we have the issue of the figures not being so, encouraging at all, So I want you to tell us, what is the country doing to ensure that we, reduce these figures to the barest minimum? Because we are, it's still possible to eliminate it entirely, but reducing these figures, talking about over 190,000 deaths, yearly. So talk to us, Prof.
Yeah, so the thing I need to say to us is that we have made progress. I think we need to keep discussing this in context. We might not like where we are, but I think it will be inappropriate for us not to appreciate where we are coming from. It's an important thing. Malaria is not a very easy and straightforward disease to combat, because if you just look at something about the world generally, the bigger an animal is, the fewer the amount of death it causes. So you can think of how many people die because of lion eating them, elephant knocking them down. But when you begin to come down to bacteria, to parasites, to viruses, they kill in their millions. And malaria is a bit more complicated because it has a host, intermediate host, which is the mosquito. So you sort of have a tripartite battle that you are fighting. And it's a very intelligent infection that mutates and changes very rapidly. That is why it has taken over 50 years to produce the first malaria vaccine. That said, what we're also saying is that now we're talking about accelerating this effort. So no one is underplaying the fact that we need to get out of the position where we are. And in that regard, really a lot is being done. The interventions we're deploying have their measurable successes, from nets to getting people tested to accessing anti-malaria drugs. We are also engaged in multi-sectoral collaboration. In a roundtable discussion earlier today in Abuja on this malaria, we brought out several stakeholders, from the military to the National Space Research Agency to the private sector, and everybody could see the interplay. But as we're moving on, so what happens is you take mass actions, you bring down a disease to a certain level, then you begin to take more targeted actions as you go towards elimination. And that is how we are making that progress. So currently, we are emphasizing more development issues, citizens engagement, community engagement, empowering the people, getting the right messages across, as you alluded to initially. But you see, there is also the challenge between the information you pass, the people imbibing it, putting it to use. So we have human behavior issues, which is why, as much as is practicable, we try to opt for options that could limit the dependence on just human behavior. But that is a fact of life that we need to continue to engage in, using very innovative communication tools and strategies. So we are attacking it from preventive angle. We're also attacking it from the treatment angle to limit mortality, and we've made progress. Then we are also working on our data. Later this year, we'll conduct the National Malaria Indicator Survey in the country. The last one that we cited is the 2021 data. between then and now, there has really been a lot of progress, and we need to have the current assessment so that we have a true reflection of where we are. So that study is going to occur before the year runs out. We're also improving that the country has what we call the National Malaria Data Repository, that is an extraction from the database of diseases in the country. And through this, we are getting more real-time figures as to people's presentation in the hospital and trying to correct for any error in those data. So one area that we also have to work upon is to ensure that we have the correct figures about the malaria situation beyond estimates that we have always used, because estimates may not be able to capture some progress that are being made. There's a way estimates are made, and there's a way where real data goes. So it's a combination of all: accuracy of data, making more progress in intervention, targeting the intervention, and citizen engagement.
Okay, Prof, but I'd want you to just answer up quickly. You talked about the vaccines. How available are these vaccines really?
Yeah, so currently we are in a pilot phase. Things like vaccines are interventions that you really want to ensure you have it appropriately. So in this pilot phase, we have 1 million doses that are being deployed in Kebbi and Bayelsa State. Kebbi, because Kebbi had the highest prevalence, and then Bayelsa State, the equivalent state in the southern part of the country, that will make the use of the 1 million doses to be appropriate. So this was how that decision was made. So currently it is still limited to those two states. And we're talking about learning from its deployment, the deployment in those two states, finding out certain issues that could occur that will be informing the scale-up. However, the vaccines are not as cheap, and resources are also some limiting constraints around it. But that's the situation of the vaccine for now.
Well, thank you very much, Prof, because I really wanted you to say something about that vaccine. Quite a lot of questions have been asked around this. Thank you for clarifying that. Now, to you, Chuks, tell us, how can communities, individuals, religious leaders, traditional leaders, play a role, or what can they do in the fight against malaria?
Well, everyone has a role to play. Individuals, the community, and everyone collectively. So, and a lot of interventions have been rolled out, but the uptake sometimes is still very poor. And this is because some people think that assessing these interventions might not give the expected result from them. So, for instance, in FCT, there's been the implementation of seasonal malaria chemoprevention. And we've noticed that in some particular areas, there are still 1 or 2 persons who don't want to be part of this intervention.
Okay, well, so what can they do, like individuals? You're talking about, breeding ground for mosquitoes. What is their role in their various communities?
Okay,
what is very important.
Yeah, so community awareness is key, and all they just need to know is that they don't have to allow stagnant water and dump sites, because these are really places where the malaria parasite vector can breed in. And so if they keep their environments clean, not allowing stagnant water and all that, it will drastically bring down the level.
Thank you very much. That's Chuks Alo, is a monitoring and evaluation officer, FCT Malaria Elimination Program. Thank you so much for coming on the program. And also, via Zoom, we have Professor Lugbenga Mokolu, Strategic Advisor to Minister of Health and Malaria Elimination in Nigeria. And he's also the co-chair, Rollback Malaria Case Management Working Group. Thank you so much for coming on the program, Prof.
Thank you for having me, and thanks to all the viewers.
And thank you for being part of the program. I'm Ikeria Clinton. Have a wonderful weekend.